Good afternoon, Ms. Knight. My name is Dylan, and I'm going to be your nurse this afternoon. And the doctor's asked me to come in and assess your abdominal area and your perineal area, do some distension. I've heard you've had trouble urinating, so we're going to try to fix that with an indwelling catheter that I have an order for. Just going to glove up here. Can I have your name and date of birth? Alright, Charlie Knight, 8839, and your allergies? Latex, penicillin, and betadine. Alright. Just going to move the sheet down here real quick so we can assess your perineal area and abdomen. We're going to pull up your gown a little bit as well. Okay, there's definitely some distension going on. And I can see the meatus, and the perineal area is clean, so it doesn't need any cleansing prior to insertion, other than what's recommended. Just going to spread your legs a little bit. Alright. Just going to assemble the supplies and we'll get started. From the hand hygiene again. And for the purpose of this procedure, we want to check and make sure that the packaging is intact. There's no visible moisture, perforation, anything of the sort. The expiration date is 4/2017, so it's not expired. And for the sake of this, we're going to assume it's not opened. And there we go. Open it away from me first. Left, right, using the 1-inch margins. And we are going to discard this barrier because we're not going to be using it for this procedure. And we're going to be picking this barrier up by the corner and touching only the shiny side. Touching the 1-inch margins, placing shiny side down, and going to glove up over here. Not turning back on my sterile field, maintaining the sterility of the interior of this packaging of the gloves. I'll be gloving my dominant hand first, touching only the interior of the glove. Now I'm going to be gloving my non-dominant hand, touching only the sterile outer portion, making sure not to touch my thumb. I can render this surface a little more stable. Touch only the exterior, sterile to sterile. Okay. And first, I'm going to open my hydrogen peroxide, soak my swabs completely, discard that. Going to open my lubricant. I'm going to reorient my box, maintaining a sterile field and with attention to the 1-inch borders. I'm going to remove the sleeve of the catheter. And this can be discarded over here, rendering that non-sterile. I'm going to apply lubrication to the tip. Alright, and put a little of the excess into the packaging in case we need more. You can also place that over there. And we're going to uncap the syringe filled with 10 mL of sterile water, which is going to be used to inflate our balloon in our cath, which is per the manufacturer's recommendation. Alright. Have everything in place. I'm going to place this back on here so we can transfer it to the sterile field we've established on bed. Alright. And that sterile field is no longer relevant now that we're over here. And first thing, I'm going to place my right hand, my non-dominant hand, separating the labia so I can see the meatus, and for the cleansing process, rendering my non-dominant hand not sterile. And I'm going to clean far side of the labia first, the near side, and the middle. Repeating that. Far, near, and middle. Okay, and we're going to place that and remove this from the sterile field as it's no longer needed. Let's get that a little closer. And now we're going to insert the catheter. Or Miss Knight, if you could take a deep breath and bear down for me. Encourage the patient to utilize the Valsalva maneuver to minimize the discomfort upon insertion. And I'm going to insert initially 2 to 4 inches until the presence of urine is noted in the catheter, making sure not to touch any of the external genitalia or the outside of the meatus. Okay, then it's present, I'm going to insert 1 more in. Okay, now I'm going to stabilize with my non-dominant hand and insert the 10 millimeters or milliliters of water. So we're going to back to the recommendation. Okay, I need to reinsert a little more as the water is protracting slightly. Okay, I'm going to re-apply pressure. Reinsert 10 mLs. Okay, now I'm going to tug gently. Okay. And the procedure is now over essentially. And what I would do now is tape at the bifurcation to the thigh with a little bit of slack to ensure there would be no tugging, so the catheter would not be yanked out. And I would secure the bag, the output bag, to a non-movable part of the frame. And I've noted 250 milliliters of Sterile urine, and it's odor-free, consistency is good, clear, and I would document, ensure peritoneal and catheter care every shift, and I would document intake and output.